My name's Sarah Drew. I'm a research student at Oxford University studying for a Doctor of Philosophy. I'm going to Malawi now to look at the impacts of Clubfoot on children and their families. So I'm very excited.
Clubfoot's a condition where children are born with one or both feet twisted inwards. We don't really know why it happens. If it's caught early enough and children enter treatment in infancy, then it can be completely treated and the children can live a normal life. Around 800 children are thought to be born annually with clubfoot in Malawi. Those that aren't treated can live a very difficult life. It can make it very painful to walk and participate in everyday life, which is particularly problematic in a predominantly agricultural society, and it can also result in ostracism from the community. There are 23 clinics that currently deliver treatment throughout Malawi, and most of those are located in district hospitals.
What we're going to do today is we're going to go to the Lakeshore region, where we're going first of all to the district hospital to obtain some sample information about participants. We're then going to be picking up a mother at the district hospital and going to her village to do an informal interview, and then onto another participant for an informal interview.
This is my third trip. So the first trip was focused on the experiences of healthcare professionals, so doing observations and interviews in the clinics. The second trip was really focused on the mothers and the children and their experiences of treatment and the impacts on their lives. So this third trip is really just a tying up of loose ends, revisiting some of the clinics and some of the mothers and children that we've already met.
We're currently at District Hospital in Malawi. We're here to look at the treatment records to try and get some participant characteristics which we can use for our study. We're then going to go over and follow the rehabilitation technician to look at him doing some casting and taking some photographs. It's absolutely boiling. There's no electricity at the hospital, so the room's dark. And we're a bit tired after a long journey.
These children are treated with something called the Pontei method, and that involves plaster casts over a series of weeks, usually 5 weeks, which gradually move the foot into the correct position. Most of the children then have a small operation under local anaesthetic. After that, to hold the feet in the corrected position, children wear braces for about 2 to 3 months full time, and then just at night for 3 to 4 years. The Pontei method can be easily taught to a range of healthcare professionals, and once they know how to do it, they can deliver it time and time again. It's also very low on resources as well. All that's needed is plaster of Paris, braces, and then equipment for the small surgical procedure. So it's brilliant for low middle income countries.
Okay, so we're just approaching the village now with one participant. So we'll be doing sort of an informal interview, an observation session. So instead of recording the interview like we've done in a lot of other cases and sitting there taking notes, we'll be going and having a sort of informal chat.
When we first met this boy about 6 months ago, he could hardly walk. It's great to see how much progress he's made in that time. In this particular trip, we're just going to talk to the family one last time to talk about the progress of the treatment and how they see themselves moving forward. And it's great to hear that they're optimistic for the future. It's enormously hard for the families to get this far. They experienced a number of challenges along the way, so it's great to see them and to see that they've reached this point in the treatment. The research which I've been doing in Malawi for the past 3 years is going to help hospitals improve their services, and it's also going to improve patient access to treatment in the future. I feel really sad saying goodbye because I really feel like I've built up some brilliant personal relationships with some of the people that I've met here, but I'm really glad that I've had the opportunity to work with them and hear some of their stories. Now I'm back in cold, wet England. I've got to collate all the information that I've collected and try and make sense of the data.
I've just got home after a very long trip. I'm pretty exhausted, but I had an amazing time, met lots of amazing people, heard lots of amazing stories.
And it's those stories that I need to write up and analyse over the next few months.